Welcome to Your Family Dog, a podcast dedicated to helping families love living with dogs.
Hi, and welcome back to Your Family Dog. I'm Julie Fudge Smith, and I'm here with the incomparable Tina Spring. And today we have a return guest. As everyone knows, Tina and I love to have guests come back to Your Family Dog. And this one is my good friend, Mike Morales, Dr. Mike Morales, who is a medical instructor at the Jacobs School of Medicine at the University of Buffalo. Is that right? Did I get that right?
Correct.
I got it right.
Pretty close.
So the last time Mike was here, we talked about endocrinology issues and vaccines. And so this time I corralled him and said, let's talk about medications. And why is it, one of my big questions is, why is it that certain medications such as Prozac can be used across species, like mice? And I don't know how you tell a mouse is depressed, but you can apparently. Depressed mice don't do as well in mazes. So if you give them Prozac, they do better. Is that right, Mike?
Yeah, more or less.
So mice can be depressed, and we know dogs can do well on Prozac, as do humans. So why is that some medications are cross species and very effective, but other medications like NSAIDs, for example, you should not give your dog ibuprofen without the explicit instructions of how to do it from your vet. So anyway, that was kind of what spurred my idea to ask Mike to come back on. And so with that, Tina, you still get to ask the first question.
Oh no, I'm ill prepared. So Mike, why might NSAIDs not be well tolerated by species other than humans?
So it has to do. So the first thing to remember is that dogs and humans are much, much more alike than different. And so if I had to guess, and again, I'm not a veterinarian, so my guesses are not worth much.
And he doesn't play one on TV
and I don't
either.
play one on TV. But the I think general assumption would be they probably ought to work the same. There are differences, and these differences are typically due to the way the body handles the drug. So when you think about it, a drug, it's not just placed directly in the brain or directly on what hurts. You have to swallow it. It has to get from the stomach or intestine into the bloodstream. So that there's a transport process that has to take place. Once in the bloodstream, it circulates around. It will go through various tissues, mostly the liver. The liver then can change it to activate it in some cases. It also is needed to change it to inactivate it. That's why when you have to keep taking pills, they wear off, is because the liver metabolizes them. And in some rare cases, they can be changed in ways that just don't occur in humans to make them poisonous. And while I'm not an expert on this specific case, it is something along those lines, so that in effect, the dosage becomes much too high, or that it's metabolized into something poisonous that the dog's system simply can't handle, and it becomes dangerous. There's not really, if you're sophisticated enough, you can make some guesses on this, but really most of it's pretty empirical. And so there's no real way, the example of you drop a pill on the floor and your dog gets to it. You can't really say with any confidence whether it's going to be a problem or not, unless you really got that kind of expertise. And that's why, there are poison control centers and veterinarians and people who are expert in this kind of thing. So.
Excellent.
Yeah.
So, for example, when I find Prozac to be an interesting one, because it used to be that people didn't think that dogs had emotional lives, right? But obviously,
thank goodness that ship has sailed.
Yes, and obviously they do if we can affect their emotions or their apparent emotion with medication. So what is it about something like Prozac? Is it because of the particular part of the brain it's working on that is more of the emotional part of the brain? Or why is it that some drugs are so effective across species?
Well, so first of all, they have to get through that process of, are they metabolized so that they're made inactive? Are they metabolized so that they're made dangerous? Assuming none of that stuff happens, then in a lot of cases, this ought to work. Again, even something as complicated as the brain, a human and a dog brain have much, much more in common than they do separates them. It's pretty clear that most complex, really all complex animals have something of an inner life. Although we can't really, what a dog is feeling, you can't really call it depression with any confidence. You can't put yourself in the dog's shoes. You can judge empirically that the negative behavior seems to get better if you give the dog the drug. Right? But while we know in a molecular sense what an SSRI like Prozac does, it increases the amount of a neurotransmitter called serotonin. Why exactly that helps some people who are depressed and some dogs with some sort of emotional issue and not others, nobody can really say with any confidence.
I think a lot of times the reason we go to Prozac with dogs is that it increases neuroplasticity. So like a trainer or behavior professional is brought in to really help modify how a dog emotionally feels about something, the association that they've built, kind of classical conditioning, and then hopefully with operant conditioning, molding how the dog is responding to a stimulus after we've adjusted how they seem to feel about it, because the feels kind of come before the doing. I think a lot of times we go with something like fluoxetine because it greases the skids and just makes it easier on the dog and hopefully the family.
Right.
Because when we have a highly anxious, reactive, or heaven forbid, aggressive dog, as trainers, as behavior professionals, we really run the risk of losing the family. And if we lose the humans because the work is too hard, or it's they don't feel like they're being successful, or how they feel about it, then we obviously can't help that animal either. So I think fluoxetine is a wonderful one to talk about, where I have seen it be a complete game changer in some animals, including my own, and then have weaned them off of it. Right, that they didn't need it forever. And I think that's the other piece that humans sometimes think, like, oh, if I start this drug now, we're gonna have to do it forever. I'm like, no. If you start it early, like if you start it when the problem starts, you generally don't have to utilize it a super long time with dogs, which is also wonderful.
Mm-hmm.
I wonder if it works with cats. I don't have a feel for whether or not they use fluoxetine with cats.
I don't know.
Cats are basically aliens. So like my veterinarian is like,
we allowed to talk about cats?
Cats are an argument for aliens on the planet, because nothing.
We need to get Dr. Lily back on, because she does do anxiety in cats.
Oh, I need a name for somebody who does anxiety and aggression in cats, because I get that call all the time. I don't know why, but
Leanne Lilly at OSU.
Okay.
She had a behavioral medicine there. She's fabulous. She does all kinds of cat stuff.
Wonderful.
Yeah.
But I think the important point about this is that you can't predict, based on what a drug like this does in humans, you can't predict what it's going to do in dogs. Your argument is complete, right? So arguments about neuroplasticity and stuff, I don't know, but it's an empirical argument. You've tried it. It seems to help. Lots of people have similar experience. Lots of trainers have similar experience. There may be even double-blind controlled experiments on it. Based on that, a body of knowledge is built up. It doesn't seem to do the dogs any harm. So there it is. It's not outlandish that it would work this way, though. And in fact, in most cases, I would expect these things would work in pretty similar ways. But dogs are also complex like humans, and the only way to find out is to try.
And everything's a study of one, right? Like in the end, it's the patient in front of you and their individual stuff.
But just like with humans, I know the behavior vets at OSU, one of the reasons why I oftentimes will recommend that somebody go there if they're not having effective stuff is because my knowledge of psychopharmacology is maybe it's like 2 inches long. My general practitioner vet, he gets 6 to 8 inches, but the behavior vets have like 36 to 48 inches worth of knowledge on psychopharmacology. And so what I try to encourage people is that even if you try Prozac, which is a pretty good go-to with very few side effects, right? So it's a good one.
Very well tolerated.
Yes, well tolerated, few side effects, easily weaned onto and off of. It's not a bad place to start. It may not be where you end up.
Right.
The reason why you want to talk to somebody who knows what they're doing is because it can be combined with other drugs to boost its effectiveness, or maybe you go to the benzodiazepines, or maybe you go to some of the other ones. But it is amazing to me, the combination of drugs that you can do. And I don't know if it's the same thing with humans or not, but it is definitely worth trying if your dog has anxiety issues. Oh, and also too, if your dog has aggression in addition to that, you got to be careful what you give them, because some of them, are, inhibitions.
Yeah. Like I had a veterinarian put one of my fear aggressive dogs that was my own personal dog on amitriptyline and turned him into a fuzzy alligator. It was like, well, this is fun. And the downside of that med in dogs is it takes a long time to get them on it, but you can't just cold turkey stop. You have to wean them off of it too. And so Chipper was like chompers until we could wean him off of it. So Mike, are there classes of drugs that off the top of your head, people need to be really careful with dogs?
I would say everything. I mean, unless you know what you're doing, I think you're taking a chance. I mean, I know of a few cases, but I certainly don't know these things off the top of my head. And, this is why we have veterinarians.
Right.
And I think you made a sort of alluded to this earlier. If you give your dog, say, Prozac, and it doesn't seem to be doing anything, don't just stop it.
Right.
To the vet first. Maybe the dose needs to be adjusted. Maybe it's a drug they need to be weaned off. But it's a terrible idea just to quit giving a drug that's been prescribed for a dog without some sort of supervision. Unless you've got extensive experience with this stuff, you just don't know how it's going to go down.
Right. Well, and I would also say that some of the signs, like I sometimes get people, oh, well, we tried Prozac last year and it made the dog more anxious. And I'm like, oh, okay, well, was that at the minimum dose? They're like, yes. I'm like, well, that was a sign that it was working, but that the dose was too low. But there does seem to be this disconnect. I think sometimes veterinarians, and I imagine medical doctors too, sometimes assume that the person at home is going to anticipate what to experience, and they don't really orient them always so great. So a lot of times when I have a client, I'm like, okay, if your vet wants to start them on something, call me and let me know, and I'll walk you through what you can expect to see on the handler end, and kind of what it seems to be teaching us about that medication.
And just be aware that sometimes it might be complicated. So it may take a few tries to get the dosage right. It may be it's not the right thing for your dog.
Absolutely.
You may have to try. It's like any other complex medical problem. You may have to try a few things.
Well, the other thing you have to be aware of too is that you got to be honest with your vet about everything you're giving your dog, including over-the-counter supplements. Because if you're giving your dog tryptophan to calm it down and then you add Prozac, then you're talking about some problems because you might have too much serotonin in the system. And so I think it's also important to understand that there can be drug interactions between not only prescription drugs, but prescription drugs can have interactions with non-prescription drugs. It's just kind of like if you're on I think blood pressure medication, you have to be careful of the cold medications that you take because they can have some negative interactions. It's the same thing with your dog. I remember with my holistic vet, and he was saying one of the things you need to tell us is whether or not you're actually getting the dog to take the medication. Because if the dog's not taking the medication, then we don't, we can give you ways to get him to take the medication. Don't just give up because he won't take it. So I think that we have to be careful with what we do with our dogs, in the same way we'd have to be careful with our children or ourselves. That the vet needs to know everything that's going into your dog. Because I remember when Zuzu got caught in the weasel trap, and I must have told you about the
That needs to be the title of a book. When Zuzu got stuck in the weasel trap.
And I took her it's a very long and convoluted path to the emergency vet, which I finally got to. And the trap, we'd already gotten the trap off of her, but my vet said I'd need to have her seen. I was in another part of the state. And so anyway, finally got to the emergency vet and they saw her. And I said, look, I think she is really sore. Can I get some pain medication for her? And he gave me one, and I told him very clearly that she was on Prozac, and he actually gave me a pain medication that you should never give to a dog on Prozac. And I didn't know about it until later. Luckily, there was no side effects, but even there, you have to make sure that get informed yourself. Is another thing too. Is that and make sure you tell the vet, because mistakes can happen even there as well. I can't remember the name of it's not a pain medication they use very often. It's a very mild one, but nonetheless.
Gabapentin?
No, it wasn't GABA.
It wasn't gabapentin.
No.
GABA goes fine with fluoxetine.
It does. I love GABA, actually. I remember I had her for my foot surgery.
Gabapentin has actually given me deep restorative sleep back.
Yes.
Wow.
Oh, love
A
gabapentin.
really low dose of gabapentin. I do worry about it a little bit because apparently it can create some psychosis. But
But so can lack of sleep.
Right. I mean, so the working theory that the nurse practitioner told me was that my pain tolerance is so high that I have pain that doesn't register. And so I can't get comfortable enough to deeply sleep. So by giving the gabapentin, it deals with that nerve pain and then I can get into deep sleep.
Yeah.
I don't know.
Anyway, so you got any other thoughts on medication here?
So I wasn't around at the time that we did your endocrinologist conversation. So
It was really good.
I'm really curious about a bunch of stuff. So, part of what we're seeing in dogs right now is early spay neuter, like as soon as puppies weigh 2 pounds.
Mm-hmm.
So I'm not asking you to give a veterinary answer. I'm asking you to give a human medical answer. But if we were sterilizing children pediatrically, how would that impact the body and development? What might we see happening if we were putting children moving them into a sterile condition where they couldn't reproduce?
Well, so at times during history, this was done. In fact, a lot of old choral works, Handel's Messiah was scored. The high voices, the women weren't allowed to sing them. They were scored for castrati. It's right on there. Boys that had been castrated, but good singing voices, who'd been castrated to keep their singing voices. It turns out that the thickening of a voice box and the deepening of a voice is due to levels of testosterone in pregnancy, increase in testosterone in puberty. I'm sorry.
Puberty and pregnancy. I was like,
in puberty. In puberty, and that's why men tend to have deeper voices than women. So what it would do is it prevents the sexual development that you go through at puberty. In some ways, it's well known in animals and humans, you can reduce a male's aggression through castration.
What about other issues? Like, do these male hormones or female hormones, what effect do they have on other systems such as bone density, or do they have an effect as far as?
So you'll tend to be a little taller because estrogens and androgens close up the growth plates during puberty. Right?
Okay.
Estrogens do it a lot more effectively than androgens do. That's why we've all remember from school, where in elementary school, most of the girls were, if anything, taller than the boys. And typically the tallest kids were always girls. And at puberty, this completely reverses itself. And it's mostly because the boys continue to grow for a couple of years where the girls stop. And that's due to high levels of estrogens closing up the growth plates and the long bones that keep you from getting taller. It will have a negative effect on bone density. Women who have had hysterectomies fairly early in life will oftentimes suffer from terrible osteoporosis. We know a lot better now, and so they can be treated prophylactically to try to head off some of the problems. But you've got older relatives who were treated that way. their osteoporosis could be awful.
Well, that's interesting because I know they did a study with golden retrievers and early neutering of golden retrievers. And what they found was there was much more of a tendency for these dogs to develop, which would basically be ACL tears. They're not called ACL tears, but because
Right.
the long bone growth was too much, so that the proportion between the femur and the tibia, or the relationship between the main thigh bone and the lower bone was off, causing problems in the knees because they had been spayed early.
So I think some of that's also has to do with the estrogen working on and I imagine testosterone working on tightening up ligaments at the end of bone growth.
Actually, that's a little more complex. There's an additional hormone in at least human women, I don't know about dogs, called relaxin. This is why women are so much more flexible than men, and it's a very important hormone in parturition and giving birth, allowing the birth canal to expand. So it's a lot of this is part of the normal sort of maturation process there that sex steroids don't directly contribute to, I don't think. But yeah, it's you kind of make your dogs sort of perpetually children. And then you have to decide whether that's desirable or not. And the timing, I think, can be tricky.
I bet. Well, we're seeing Dr. Karen Becker talks about that they're seeing a huge increase in atypical Cushing's and Addison's disease, and that appears to be linked to early spay neuter. Right? So we're trading one problem for another problem.
Cushing's and Addison disease.
I believe she said both, but I might be misquoting her.
So Cushing's disease is where the adrenal glands produce too much of a hormone called cortisol. And Addison's is where they don't produce enough. So typically it's an autoimmune disease. So you don't usually see one or the other, but again, we're sort of wandering a bit outside my expertise here.
Of course. And I'm not saying that she was seeing both in the same dog.
No, you wouldn't.
You wouldn't.
Right.
You couldn't possibly.
But, and it's possible, I mean, so Addison especially is mostly an autoimmune disease. And I don't know if veterinarians are seeing the same things as we're seeing in humans, but autoimmune diseases in general are a lot more common than they used to be.
So do you think we're just better at diagnosing them, or do you think the prevalence is going up?
I think the prevalence is going up. I think that's what the evidence is pointing to. It's not, there's a lot of theories on why, but nothing.
Do you think it could be nutritionally or environmental factors?
Maybe.
Or all of the above?
Right. So genetics hasn't changed.
Right.
So it's got to be something along those lines. Right. But saying nutritional or environmental is there's a lot of factors there. And it doesn't really point you in a direction.
Okay.
But, along with type 2 diabetes, which is not an autoimmune disease, we've seen an increase in the rate of type 1 diabetes. We've seen an increase in the rate of Graves' disease and somewhat in Addison's. Hashimoto's thyroiditis is more common, and other non-endocrine autoimmune diseases are also seem to be more common.
Huh.
It's really interesting.
That is. I don't know if that's true in dogs or not. That would be interesting to find out.
Yeah. I don't know.
Because I would think that if there's some sort of environmental factor, it would be affecting more than just one species. If it's, sort of a global environmental factor as opposed to.
That would be curious, wouldn't it? If you saw if you had a way to report not just human medical changes in a community, but also companion animals.
Yeah, that would be very interesting to see.
There's pretty limited data on that kind of thing.
I imagine it would be difficult to compile.
Yeah.
So one of the questions I had for Mike too was when we were talking about drugs, I said, do males and females metabolize drugs differently? Do certain drugs affect males and females differently? And that was an interesting question. You want to give her a little?
Yeah, I mean, the short answer is yes, a bit. Again, though, it's one of these things. You're not giving drugs to a population. You have to study them that way, but you're giving drugs to an individual, and just like in a room of adults, you would expect the men to be the tallest. You wouldn't be shocked if a woman was the tallest. And I mean, empirically, we know this happens. And so while there are some factors to keep in mind about the way different sexes metabolize drugs, specific drugs, it's hard to make general statements. A lot of drugs, you just have to work with your physician to find the right dose. I mean, we all want it to be kind of push button where they, especially the docs. I'm prescribing you this, you will take it, you will get better. But alas, it frequently, and that's what we all want, but alas, it frequently doesn't work that way.
Okay. So you had any other endocrine questions? Because that's really his.
I don't know. I wasn't really prepared.
I just sort of sprung an endocrinologist on you at the last minute.
So what kind of things that are outside of the body influence the endocrine system?
Well, there's a lot of things. I mean, there are a lot. So one of the problems with the environment in the endocrine system is that hormones are in the bloodstream at incredibly low concentrations. And we can get away with this because the receptors for those hormones bind them so tightly. But what that means is that chemicals in the environment that are there at fairly high concentration, things like phthalates and plastics, can interfere with endocrine receptors in ways that are not entirely apparent. And I think this is a huge coming issue. Nobody really wants to deal with it. But it's clear these things are happening and that we're going to have to find some way to deal with it, but it's going to be enormously complicated. There are tens of thousands of chemicals in the environment now that weren't there before the Industrial Revolution. Very few of them have been studied in this regard. And what ones are ones to worry about, what ones aren't. But we know, for example, sexual development can be completely short-circuited by environmental factors. Because as you develop, a fetus starts off indifferent. As it develops into a male or a female, it starts off with the same genotype. But as it develops along a male or female line, it starts to happen around 8 weeks. That endocrine factors can completely change that. And sometimes they're natural, they're as a result of a natural disease process, but they can be environmental too. And something that nobody really knows what to do about. It's a tough question. So there's that. And there's probably other things out there as well, but.
So what you're saying is that some of these chemicals that are in the environment may have a similar enough molecular composition that they will go into those receptors that are designated for hormones because they're similar enough that they would be picked up by the body as a hormone, even though they're not.
Yes.
Okay.
Wow, you're really good at this.
Thank you.
Okay.
Well, Mike and I were biology partners together in college. We died how many? Many years ago. Yes, we cannulated a rat together, and we measured the oxygen uptake of a gerbil together. Anyway, so this goes back.
That sounds fascinating.
It was, actually. We had a lot of fun. We did blood labs together too. Yeah, that was fun. Stabbing each other with little lances to the blood lab.
Turns out I'm a much better.
He is. I had this really rapid clotting time. We had to keep stabbing Mike.
But I just I just bleed. So
yes.
Just wouldn't give you any blood.
No, I wouldn't. He would. Anyway,
bleeder.
He's the bleeder. I'm the clotter. Anyway,
you're the clotter. I'm
the clotter. But anyway, so be that as it may, that's sort of an odd aside. So what happens then if an environmental chemical is now bound to one of your endocrine sites, to a hormone site? Does it get released, or are we now then not able for then the natural hormone to be taken up by the body?
It's complicated, but in most cases it'll get released. Mm-hmm. I mean, so your body has a system for handling foreign chemicals. And, again, it's the liver detoxifies things. It works better on some chemicals than other chemicals. If depending on how the molecule interacts with the receptor, your body may be able to compensate by releasing hormone.
Okay.
It's hard to tell without knowing any specifics.
Okay, so where are most of these endocrine hormone receptors? Are they in the brain or are they in a variety of parts of the body?
The left earlobe.
Yeah. I hadn't really considered the left earlobe, but no.
Have you looked there?
No, we pretty much stick with the right.
We stick with the right.
Right.
Like, is that why children pull on their earlobe?
No. No, every cell in the body has receptors for hormones.
Oh, okay. Okay.
Oh, okay.
Not every hormone, but yeah, hormones affect every tissue in the body.
So it seems to me that that's also, in some ways, if you had this environmental stuff adhering to receptors for hormones, you would probably get some interesting sort of side effects in much the same way that you get side effects with drugs, right? Because if you get the wrong thing adhering to the wrong place, you could have some interesting results from that. Well, I know, like, I remember listening to a radio program and I kept thinking, oh, please, 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 just be quiet, be quiet, be quiet. And the guy was saying, he said, I don't understand that when you take like an aspirin or a Tylenol or whatever, and, how does it know where to go? How does it know?
It doesn't.
That's what I said. I'm like, that's why we have side effects, because when you have a drug, it's circulating through your blood system. So it's going to all the cells in your body. And the ones who are in pain are like, oh, thank goodness it has finally arrived. But the other ones are like, I don't need this.
Okay.
So I'm going to, give you an upset stomach.
So no, it doesn't work like that. So it will go everywhere where there's receptors.
Okay.
And so for a good example is the hormone epinephrine or adrenaline.
Okay.
And it's released by a little gland on top of your kidney called the adrenal gland.
Okay.
Now you go to a scary movie or something along those lines, and you get startled, and your heartbeat immediately starts to get faster, right?
Mm-hmm.
And that due to a hormone being released. So your brain takes those sensations, it sends them down your sympathetic nervous system, it signals to the adrenal gland, release adrenaline.
Okay.
And your heart, within a second, your heart is beating much faster.
Okay.
Right? Now, the hormone wasn't sent to your heart, it was sent to all over your body, because there'll be other things that happen. If you had to go to the bathroom, you might not anymore. Right? That's one of the things that scare does to you. It will cause you to sweat in certain ways, like under your underarms.
Okay.
It will cause your hairs to stand on. They call it peleomotor reflex or goosebumps.
Right.
Right. And it causes other physiological effects. These effects occur because these tissues have receptors for that hormone. The hormone in no way knows where it's going. Okay? These effects stop really quickly. So as you get over the fright, your heart slows down. And that's because the hormone is consumed. Your body metabolizes the hormone and gets rid of it and gets ready for the next fright. But a lot of times it doesn't even have to happen. So if, the guy jumps out from behind the curtain and cuts up someone with a chainsaw or something like that, right? Your heart starts beating faster. The next time you see a guy behind the curtain with a chainsaw, your heart will start beating faster on its own. Your brain has learned that stimulus, sends the warning down the sympathetic nervous system, which releases the adrenaline to get you ready for, a presumed attack by a guy with a chainsaw from behind the curtain. Oh. Sleep well.
So that's interesting, because I want to say that they took Buddhist monks who were at the highest level of the meditative process, like they were the highest evolved in that program. And they compared and contrasted them with more typical walk of life people. And what they saw was that didn't happen with the monks. That their brain, their body does not respond to pain until it happens. Even if they've had, you stab their finger with a pin, until the actual pain receptor goes off, they don't have a response. And the next time, 20 minutes later, you go to stick them with a pin, they don't anticipate the pain. It was a really interesting, and I don't, for the love of me, remember where I heard that. I want to say it was like a podcast about the brain. Yeah, they were talking about the things that meditation changes.
Yeah, and that can happen. I mean, I bet if you had a strong enough stimulus that they would have some response.
Oh, of course. I
but-
assume if
but,
someone
yeah,
came
no,
at a
you
Buddhist
can
monk
learn
with
to
a
modulate.
chainsaw.
Right. No, you can learn to modulate that sort of stuff.
Yeah.
So-
Well, and now I've always understood, and I could be wrong, so maybe you can correct me on this, is if you have an adrenaline spike, okay, something happens and your adrenaline spikes and you have this whole response, your body is much more primed for the next release, right? Doesn't adrenaline, it will get out of your system, but doesn't it take a while for your body to reset, so that if you have, for example, if a dog has had an aggressive experience and they've released adrenaline and a variety of other chemicals, right? 20 minutes later, they may be down, but they're higher than their resting stage, so that they're more likely to be reactive.
Yeah. So on the time course of 20 minutes, it's a different thing. So adrenaline is effectively a stress hormone. And when you hear about stress hormones, these things are our friends, right? Adrenaline is released to help us manage situations,
Right.
Immediate situations. There's also cortisol, which is a slower release. Okay? And that is there, again, people associate it as a bad thing, but it's our friend. It helps us manage stress. People who can't make cortisol will quickly die. It's a real medical emergency.
My goodness. Yeah.
Okay? So, and one of the things cortisol does is it helps us make more adrenaline.
Oh.
Okay. So a dog that is constantly under stress will have high cortisol levels, right? And that's a biological strategy to manage the stress. But you might get a lot of really quick reactions from it, because constantly being in a stressful situation, and again, we're all kind of here to be wild animals in a way, right? If you are a wild animal and you're constantly being preyed upon or in danger, you need to have these reactions to survive. We are now, both of us, more or less domestic, and these things can manifest themselves in negative ways.
Okay.
And this is why, a dog constantly under stress will tend to have these hair trigger reflexes.
It's because they have a high production of adrenaline.
Yes.
In response to their
high level of cortisol.
high level of cortisol.
Yeah.
So, which is why, like our horse that had Cushing's, right? He had all kinds of side effects from the high levels of cortisol,
Right.
but he was much more reactive than he had been into. So, but his hair, they had horses with Cushing's have a hard time shedding their winter coats, and they tend to get very thick curly coats, and so there's all these sort of side effects to having something like that. So I need to get you a T-shirt that says "Cortisol is my friend."
Okay. I heard a news report that they were talking about that if you don't wake up hungry in the morning, that your cortisol levels are high. And I thought, oh, well, that's been going on since I was a kid. Like, I have never been a breakfast eater. I'm like, please, no, I don't want to eat breakfast. And I was like, dang it. Stupid cortisol levels.
Yes, but you had a very stressful childhood.
Yes.
But that kind of
true.
thing goes away. If it doesn't, it manifests itself as Cushing's. And cortisol levels naturally go up and down during the day, and they're at their highest in the morning for reasons that are not entirely apparent, at least in humans. I don't know if dogs follow the same. I imagine they do. Same sort of circadian path.
Is that why Zuzu gets me up at 5:15 every morning for breakfast?
Oh, that's just because she loves you so much.
Oh, okay.
And because you feed her breakfast when she does it.
And she has you well trained.
Yes.
I'm hungry now. You will feed me. And it works.
Yeah. But
right?
I'm usually getting up at that time anyway. So,
so you're not really complaining.
A little. I just as soon sleep till 6, but I will get up at 5:30.
So it's really cute. Like in puppy class today, earlier in the week, they were talking about that their puppy wakes them up earlier and earlier and earlier. Right. And the puppy's getting older. And I was like, well, it's a lab. And I was like, well, when you get them up, do you take them out and then immediately feed them? And they're like, yes. And I was like, that might be why you're getting up earlier and earlier. He's adding a 5th meal.
Extra breakfast.
Like, this is handy. Let me wake them up.
Well, it depends. If they wake me up anytime before 5, they can go out, but there's no food. No food. Not until.
Pet sitters must love you.
I pay them really well. So, they do
So the
actually.
answer
I
is
don't know. I'm at an age like I get my best sleep in the first thing in the morning. So I'm like, no, please don't make me get up at 5:30.
Yeah, but then I go back to bed and they'll snuggle with me and it's lovely. So, anyway, it all works out. It is what it is. And, I never claim to be the trainer you are, Tina. I'm just
I'm not. I mean, as evidenced by my dogs, I'm a good people teacher.
Yes, you are.
And I'm creative. So Mike, what's one thing about the endocrine system that you wish every human knew?
okay. So this is true for humans and dogs. Sometimes your natural stress response isn't enough. This can happen if you've in a situation of runaway inflammation. Maybe you're allergic to a bug bite. Maybe you've had surgery, or you have some other inflammatory condition. You will get an artificial form of cortisol for that. And this is done for dogs and cats who have allergies or skin allergies. They'll get this powerful anti-inflammatory. We need it because we're not making enough. We can't make enough. So you get it at a much higher dose. The problem and these drugs work, they're great drugs. The problem with them is that the high doses cause your body to turn off your adrenal gland. Okay? So all the cortisol you'll be getting is from the drug. Now that's fine. But when you get these things from your vet, they'll come usually in blister packs. And you'll say 2 pills a day for the first week, and then 1 pill a day for a couple of days, and a half a pill a day for a couple of days, and maybe a quarter pill. So you ramp down the dosage slowly. Now, one of the things that cortisol does is it makes you feel good. And so you give these pills to your dog for a couple of days, and they perked up, whatever is bugging him doesn't seem to be bugging anymore. You just stop giving the medicine. The problem is you've turned off their adrenal gland so that it will take days to recover. And while they are recovering, they are sitting duck for all sorts of inflammatory GI, skin, and other conditions that they won't be able to defend themselves against because you turned off their body's ability to make cortisol. That's why you ramp it down slowly. And as you ramp down the drug, the adrenal gland naturally recovers and you can get back to normal. And this is true for both humans and dogs. So you should always take all the medicine, regardless of how you're feeling, unless there's some awful side effect involved, which there isn't usually, but if there is, you should talk to your physician or vet.
So I assume you're talking about things like
prednisone.
Oh, and it just went out of my head.
That's
Cortisone.
okay. You're of an age that's allowed to happen.
Yeah, it happens to me too. I should have said prednisone up front.
I was like, there the word goes.
Yeah.
Byword.
Yes.
It's going you.
Yes.
It'll come to me when I don't need it at 3:30 in the morning.
Yes.
Yes. And you don't know how much fun it is when the word goes goodbye and you're lecturing before 200 medical students. And it's like, I'm just going to have to dance. It happens once a year with some word. Last year it was proximal tubule, something in the kidney. And I just had to dance around it for the rest of the lecture.
You didn't have a student come up with it? Like pop quiz.
No, chances are
describe this. I'm going to dance all around it and you're going to give me the word.
Chances are they weren't paying attention.
That's true.
They weren't paying attention anyway. Well, that's a little scary.
Yes.
That's right. Especially the thing is, we're talking medical students. We're not talking history students. It's really okay if you missed the date on the Battle of, Mercy Valley or whatever. Lives are not on the line. But, it might be if you're talking about prednisone.
It's a reiterative process, and the important things that get taught a lot, and then they see them in the clinic, and it's a process. Missing one lecture is probably not going to make you a bad doctor.
It's not going to make you a better one.
No.
So anyway.
Well, it depends. If the person can't think of the word.
Yeah.
No, kidding. Just teasing.
Okay.
All right.
Not serious.
So, well, anyway, thank you, Mike, for joining us today on Your Family Dog. As usual, it was really interesting, and I feel like we've given some more in-depth knowledge to our listeners about some of the things that are going on with their dogs. We talk a lot about training issues, which have a certain depth, but it's kind of, but it's nice to be able to dig into sort of the inside of your dog a little bit more. So thank you very much for joining us today. And,
It was great to meet you, Mike.
Yes, nice to meet you too. Thank you. Thank you for having me.
so with that, thank you all, and we'll see you next time on Your Family Dog.
Thanks for listening to Your Family Dog. Got questions? Interesting ideas? Visit www.yourfamilydogpodcast.com to share your thoughts.